Good afternoon. Happy Tuesday. We hope everybody is enjoying this beautiful Tuesday. Even though it's not so beautiful outside, we hope everybody's enjoying it. We are going to be joined very soon by the beautiful Sally Hayes, who is going to be joining us right now. All right. To join afternoon session for Parent Shower Week. She's going to be joining. Hello, Sally. Happy New Year.
New Year. How's it going?
Party time. It's party time.
I love it. I love it.
I was mentioning it earlier this morning. I tried to get helium balloons so they would just be standing behind me. That did not work out, so we've got these handheld balloons. This is what we have. They're actually baby shower week balloons, but it's close enough. There's no such thing as parent shower week. It might be something we'll have to come up with. Parent shower balloons.
Yeah, I love this concept of the parent shower. Yes.
Thank you. Thank you. We're so excited to have you join us today because everything infant massage, prenatal massage, postpartum massage, we're going to talk about all of it.
Okay.
Absolutely all of it. It may sound like a lot, but we're going to just crunch it all into this time that we have together. Okay, so let's just jump right in. Sally is coming to us from the beautiful, sunny, hot Los Angeles, California area, where
Yes.
we're here.
It's a very 62 degrees today, as we like to call it.
You're so funny, Sally. I love your version of winter. Canadians will say, okay.
Yeah. You know, it gets a little chilly with your flip-flops on. That's how you know it.
Might need a sweater. Might need a sweater with your flip-flops. Okay, so let's jump right into it and talk about all of the benefits of massage, and then we'll go into the individual sections. But before we go into all of that, please tell us what prompted you to get into the work of massage therapy and this focus on parental care.
That's a really great question. Like, massage itself wasn't something that I knew I was going to go into. I literally was in college. I had a neighbor who moved out, and as she was moving out, I casually asked, "Where are you going?" And she said, "I'm moving to Atlanta to go to massage school." And for some weird reason, I had never heard, I mean, of course I'd heard the term massage, but I just had not. I grew up in a small town. I grew up on a farm. Like, this wasn't a thing people did. I grew up in Georgia, in the South. Like, massage was not in the 90s, like, absolutely unheard of. I had no idea what was happening. And for a year, it stuck in my head. And I just, it's kind of like a wave came and brought me to it. And I don't know, honestly. I wish I had a better answer. I just don't know.
It comes into your life when it does.
Yeah, totally. So, women's wellness was always something that was at the forefront of my mind. I was in school studying women's studies, and I was very passionate about the fact that, women's health was something that was kind of left behind. Most medical data we have is on men, and they would just transfer that to women, even though we have a different system. And I was always frustrated every time I went to the doctor because I just felt like I was getting, ridiculous information, and just no one could help me. And so I got really passionate when I went to massage school. I was really excited about how empowered I was and how I can empower other people to take care of their health. And that, you don't have to rely on all these other things. It's a little bit of knowledge goes a long way.
Huge.
Yeah.
And not having to take the drugs and the prescriptions and having that be the answer for everything.
Exactly. Take it when it's necessary, but don't overdo anything. Like, I just don't like the concept that someone else has that much power over you that you don't know how to handle minor things in your life. Of course, I'm going to perform surgery on myself. That's for a surgeon.
It's a different conversation.
Different, but lowering your blood pressure and stimulating your lymphatic system, like, those are things that you do have a little bit more control over than we typically have once thought. So I got really passionate about that. And then my first client out of school was pregnant,
Oh,
And
wow. That's a highlight of a first client.
right, right. And we studied it like we studied any other condition. I went to a clinical sports massage program. So we studied injury assessment and rehabilitation in every single condition you could possibly have. And so I felt very confident and comfortable working with her. And the next week I had like 7 pregnant people banging,
Wow.
or, because pregnant people travel in packs. And little
Yeah, in a group of
club.
friends, one starts, it's like a domino effect. Everybody just starts.
Yeah. And then a few years later, I moved to California and started working out here. And I found that people, specifically in Los Angeles, like, I don't know if the schools are different out here. I mean, the schools are different out here, but I don't know if they're not studying pregnancy massage, but people were terrified to do pregnancy massage. Terrified. And there's some concept that I guess had been going around the schools at that time that, like, you don't touch this, don't touch that, you're going to put them in labor. And it's just, I mean, yes,
That's correct.
few things, but like that's not the highlight at all. Like there's so
Right.
much work you can do that, like, the studies have shown pregnancy massage, regular consistent pregnancy massage throughout the pregnancy can decrease labor and delivery time by an average of 3 hours. Like,
Oh, 3 hours can feel like a week during
yeah,
labor.
that is huge. That's huge. So like it also decrease the need for pain meds. It can improve outcomes for newborns and weight gain and a multitude of things. But I could not believe that people weren't doing it. So even in Los Angeles, there's probably, I say 10. I don't actually know. I've looked around, but there's probably like around 10,
Oh
maybe
gosh.
20 that's special
You got your hands full there.
in pregnancy. Yeah. So I can't even believe it. It's so wild to me. Now, a lot of massage therapists do pregnancy, but specialize, like it's probably
Yeah.
10 people in the whole city, which is crazy.
Wow. Wow.
It's
That's
crazy.
not enough. We need more of you, Sally.
Yes, yes. We need more people doing it, but we also need more people to know that this is really effective and important. And I think a lot of people come to me after going to a spa and they're like, yeah, it just wasn't. And I'm like, well, yeah, like you're
This is
like,
not a spa treatment. This is an
yeah,
actual treatment.
totally. This
Yes.
therapeutic and health. Go to a spa like regular times, but like when you have pregnancy, you want to go to somebody who specializes it. Like just work with somebody. Like, I'm going to ask you what typical conditions you would have during pregnancy. Carpal tunnel. People are always like, carpal tunnel? That's from pregnancy? Yeah, it can be. Like I'm going to know exactly like where we're going to go and what to do. And then, I've got doulas that I refer to. I've got, like your company that I give everybody like a card for. So I have like products in my office, like this is my wheelhouse. Let's do it. Like let's help you. The one thing that I have seen is there's a lot of there's some misinformation, but there's more lack of information. I think the way women communicate is underground and word of mouth. So primarily my work is referrals. People refer all the time.
Exactly.
And it's because it's not really like marketed or like put out there. It's more kind of like, hey, I know someone.
Oh, is your ass hurting? Is your lower back spazzing?
Totally.
Oh, Sally. We're going to start screaming it to the world. If you haven't noticed, we're screaming at the top of our lungs, hoping that people will listen. And hence why we created this Parent Shower Week, because the conversation needs to fully include the parents when it comes to childbirth, when it comes to creating humans in general.
Yeah, big job.
It's probably the biggest job in humanity is creating more humans so that we can continue.
Totally. Let us support you. Let us, like, we are here. I know like your company was born out of a need. I navigated into the specialty because of a need. Like, I just want people to have access to any support and resources. Let's set you up for success. Let's set both parents up for success. I get a lot of interesting questions like, how soon can I get a massage after delivery? Immediately.
Oh, let's go through all of that. Okay, hold on. We're going to go through all of that. We're going to start from pregnancy, even though we are a childbirth and postpartum focused organization. We're going to start from the very beginning because parents need to understand that the birthing person needs to understand that when you can start in your pregnancy to start seeing a massage therapist that is specialized in pregnancy. And then you mentioned a ton of benefits already. Is there any other benefits that you didn't mention? So let's just talk about that. So when can you start prenatally?
Okay.
Any other benefits that you didn't mention? So you already mentioned that you can cut down your labor time. You can improve the baby's postpartum well-being. And tell us more if I missed anything.
Yeah, so you can start as soon as you want. The only reason that you would not get a massage in the first trimester is if you are high risk, if you are using medical means to conceive. I want your doctors to be on the same page. So
Right.
if you're fertility, if this is like your last round, like fertility is very expensive. And for the first 8 weeks until you get a heartbeat, we want you quiet and calm, like don't make any movements. Let's just skip massage for a while. If you're in the appropriate age range, if you're healthy, all things are traditional, like health wise,
Yeah.
you can get massage. It's fine. Massage will differ through each trimester. I really, really, really like working through the different phases. So I don't like to say you can't get massage, but there are occasions that I want to double check and make sure that we're all on the same page.
Exactly.
Especially if you have high issues. I don't want to do something and then your medical provider decide that I've done something. So let's just be on the same team, talk to everybody, make sure if they're comfortable with it, I'm comfortable with it. Let's work. If I've seen people in extremely high risk situations and I have worked with them, it just changes. I mean, sometimes I see people in recliners with very light pressure and just, gently calming the mind, multiples, high risk variations, like, yeah, it happens. Outside of that, not to dwell too much on that, but outside of that, yes, get massage. You generally will start amping up the frequency as it gets closer to delivery time.
Yeah.
I don't like to say I do induction massage because that sounds like there's an exit button that I'm pushing, and there's not.
There's not. It doesn't exist.
Yeah. I mean, some people say, I start around 38 weeks, changing the work into induction style work. We're doing a little bit of different stuff. We're really opening the hips. We're giving room. Baby can drop down and really start that process of coming. And there are some points, and I start teaching points. These are some points that you can do yourself if you're feeling like you're starting labor and you want to get it started. There is no exit button. It's not a one-time deal. You're not going to come get a massage and then go to the hospital.
Yes. It doesn't work like that. If only it did, but it doesn't.
Yes. But there are some things we can do. Like if you have some tight musculature around one hip, that hip may not open as much as you need it to. So let's make sure everything's balanced. I have chiropractors and acupuncturists that I also refer to for any like breech issues. Let's get baby in position. Let's set you up for success for labor and delivery. And then let's get you prepped and ready and also calm. I think that one of the best things you can do to go into labor is to be calm. It really is like a lot more about riding the waves than it is like tightening up is going to close. And so we want soft and openness as we're going into that period.
And just really trusting that your body has the intelligence that your mind does not. So doing your best to allow your mind to just float away and just let the intelligence of your body take control and follow its lead. Yeah. So can you talk about what partners can do to support mamas in terms of maybe home techniques that are not invasive or that they don't need any special skills to do in the prenatal?
Yeah. So I also have offered a lot this year, especially, with this year kind of changing everything. I've started offering Zoom instructional offerings and I know a lot of people, especially here in Los Angeles, our numbers have fluctuated. They're really high right now. And so people are nervous and, people cancel the day of, which is absolutely understandable. It's a different time of the world. But I always say, like, I'm very happy to get on Zoom with you and teach your partner some things. I've always taught partner induction stuff when, I always say at the end, let's bring the partner in. Let me just show a couple of things that they can do to support you, because partner wants to be involved too, but
Exactly. I mean, they were involved making that thing inside of you. So what
exactly,
can they do to help get it out?
exactly. Partner wants to be involved. You want partner to be involved. And sometimes you just need to have somebody, a support person that can help you with different things. So I can show some different things that are massage techniques that you can use to get from early labor into active labor, and also like during laboring times, what is helpful and what might not be helpful.
Okay. I mean, can you touch on that a little bit? Like, don't do this. Yeah, that's a good thing to know is don't do this
Totally. Like
ahead of time.
read the room, read the person, like be there, be supportive, but don't be intrusive, I think is one of the main things. There's a few points that you can work that do attach to the uterus and can start firing. There's a really cool one in the low back, right in the sacrum, that is the is where the nerves to the uterus go, and that's the one I've seen the most effective, like getting into that laboring thing.
Wow.
But also knowing when somebody needs a break and needs to rest and just needs a few moments and when to back off. This isn't a race, it's a marathon. So to be steady and pacing. And sometimes you just need a little like soft rub on the back. Sometimes you don't want to be touched. That's a lot of sensation in your body. So knowing when to back off also is like the key component.
Yes. And can you share about techniques that you can do on yourself? I mean, is that something that you can do? Let's say you don't have a partner or you're feeling some kind of pain, you're still pregnant. Is there something that you can do on your own at home or in your car or wherever you are to help?
To help during pregnancy or during
We'll stick to prenatal and then we'll transition over into each section.
okay.
So let's talk prenatally first.
Yeah, so the thing I like really about prenatal is you gain 30 to 50% blood volume in your body. And so that extra volume can put pressure on different aspects of the body, especially the joints, which is why you get swelling in your feet and swelling in your hands. So when you're showering every day, a very easy thing you can do is lymphatic drainage. So lymphatic drainage, you want to drain your neck. So when you're showering, or you can use a dry brush out of the shower, you just want to do some simple techniques to keep everything
I want to
flowing.
do this myself now.
I know it's so
It looks so nice.
like when I wash my face, I do a lot of like scooping out, scooping down, getting that like flow, done. Extremities, you want to take extremities and go towards the heart. Um, Everything in here. Legs, same way, a little bit more difficult during pregnancy to get legs, to get to your legs sometimes.
Yes.
So in
That's a
that,
partner thing. Partner can help that.
that's a part, yeah, that's a partner thing. So in that way, I would say keep your feet up. I know a lot of people are working from home now, and I always say, like, your feet don't have to be over your head. Just get them a little bit off the ground. Put a chair across from you and get them in a chair, but it doesn't even have to be that much. You just don't want that so much drainage down. Just change it a little bit. And then at the end of the day, if you can get parallel or even a little bit up, then everything can flow back, and that'll reduce a lot of the swelling in the
Perfect.
feet.
Perfect. Amazing. Completely makes sense, nice and simple. And I'm also going to mention this right now. I don't know why I didn't mention it earlier that Sally is our Healing Mama massage expert. So, in the Healing Mama guide that comes with every single one of our labor and postpartum systems, you can also get this on its own if you don't want to get the whole system. Sally has her original write up in there where she provides actual tips and practices that you can do, a lot of what we're talking about, but then you'll have it at your fingertips so you can refer to it at any time, and then also take it into your childbirth and postpartum time frame. So catch Sally in our Healing Mama guide. I want to talk now about transitioning into childbirth. So we know that there are benefits that have already been studied about the use of massage prenatally. Let's talk about, we've gone through this experience called bringing a human earthbound from within the body, whether it was from the vagina or if it was from the belly, this baby came out of you.
Yes.
And so now we're in this postpartum period.
Yes.
Or many people are calling it now the fourth trimester. All of it is very appropriate. So let's start with, what are the signs that mothers need to look out for that will tell you maybe it's time to go seek a massage therapist? Like, what are those signs?
Yeah. So actually, I tell people whenever I see them through their pregnancy and they start asking, like, when can I get a postpartum massage? And I say, as soon as possible. And it will look different in the first days, and it will look different in the second week, and it will look different as you heal in different ways. But I always say, give your partner or your caretaker, a lot of moms come in, nannies, whoever's there with you, give them my information. They're going to need to book for you. You're not going to have a schedule. You're not going to be living in the world in the same way you have been. I mean, maybe you will have a schedule, but rarely does that happen. Right. But when you start to get exhausted, when you start to get fatigued, when you start to feel like you can't make it, let's get a massage before then. I say go ahead and schedule it. I'd rather you cancel, but have it on the books. Mm-hmm. I don't mind cancellations. That doesn't upset me, especially when you're working with people like up into the delivery date, and then there's a lot of variables there. So
there's a lot of leeway that you're comfortable with.
Leeway. So I always say, don't, sometimes I show up to a house and nobody's there, and I'm like, I think, okay, it was time. They're probably,
it's about time. Something's happening.
It's fine. I'll text you if I don't hear from you. I'll just presume we're laboring and not bother you. But I really love postpartum work. I think it's very important. I think it's really, really important to get within the first week, no matter how you birth. Wow. You still get massage. I've done massage at someone's house in a recliner, and it's just been light scalp massage, a little bit of that fluid, some legs. If you're getting a hospital birth, sometimes you come home more swollen than before because of the IVs, pain meds, and we actually really want to get those pain meds out of the system. Mm-hmm. And massage do that. So massage helps flush all that fluid out. It helps get the pain meds out faster. It helps your body start healing in a better way. It also helps balance the hormones. Postpartum depression is real. Yes. And a little bit of touch really can change from being completely overwhelmed to feeling like I've got this. That's why I love postpartum work so much. As I walk into a house, there's always a little bit of chaos. Sorry, mess. They're just I don't, and it's it's fine. It's fine. If the baby cries, I'll put the baby on the table with you. It's fine. Everything. Mm-hmm. You need to get up, you can get up. I give extra time for postpartum work because I want there to be space for whatever happens. We're not operating in the same way that you would operate, before or completely after. So I like to do that. I like to pair infant massage with the postpartum massage as well.
Yes.
To give the parents, both parents, I want both parents in the room, and caretakers, whoever's around during that time, to give them some tools and empowerment so that they don't feel overwhelmed in that area as well. You feel like you have a little bit of something you can do when the baby starts crying.
Exactly. Okay. You touched on so many things. I want to go back to all of them. Okay. So let's start. Let me just recap. You can potentially get your first postpartum massage within the first week. And of course, it's about finding a massage therapist who is comfortable with coming to your home and that you are also comfortable with having in your home as well. Yeah. And then other than that, what is the general consensus of when people say now is the time for you to go get a postpartum massage? Because I have not heard that in the first week. Like that's amazing news.
Yeah, I see people within 48 hours of
Oh,
birth.
48 hours. Ladies
Yeah,
and gentlemen, you can book your massage therapist within 48 hours.
a lot. Yeah,
Postpartum.
honestly, like I would probably see them sooner, but like there's a period of time that you got to book and we got to both be available. So yeah,
Exactly.
yeah, that's probably the earliest that I end up seeing them just due to scheduling things. Now that's not going to look like a massage that you would get at a traditional spa. You might get on
Yes,
a
this
table,
is
you might not get on a table. Like if you have just had a cesarean and that's a major surgery, you may not be able to get on a table. I mean, I worked with people in their beds before. It's
mhm.
different work. We're not, it's not a routine. It's not a structured work. It's really meeting you where you are. If it's just holding the feet, if it's just putting hands on people without any pressure, that is super valuable in that time.
Okay, and then can you bring this back to the hormone rebalancing and how your techniques or how the technique of a massage therapist can help balance out the hormones that are still flushing through your body from pregnancy, and now it's looking for what is the new normal, what is the new body that I'm in now, and what are the levels that it needs to be. And so what can your massage therapy techniques do to help bring you to that level?
So we know that massage decreases the stress hormones like cortisol, right? And increases oxytocin. Oxytocin is obviously what, starts labor, and it's also what bonds you to your baby. So in those first 6 weeks, we really want you flooded with oxytocin because that's bonding. That's how you bond, that's how you pair. And so it has been shown that massage decreases the stress hormones and increases the serotonin, the dopamine, the oxytocin. And that's where we want you nice and happy and lovely.
Ooh, those chemicals all sound so delicious. Can we have that all the time?
I know. Yes, you can. Get a massage once a week.
That's what I'm saying. Yes, ma'am. Once a week. Not to be postpartum, just in life in general.
Yes, yes, yes.
And
Yeah.
then can we talk about um, the we're going to touch on infant massage later, but I want to talk about massage and its benefit for the partner, because the partner is going through a lot, not as much as the birthing person, but
Yeah.
the birthing partner will have a lot on their plate and will have to take care of majority, if not all, the surrounding work while the birthing person is healing, is recovering, is bonding with baby. So can you talk about why it's important for a birthing partner to also go and get a massage themselves?
Yes, yes. I actually really love this because I do primarily work with women and birthing people, and then there are, the part people are always like, "Would you also work on my partner?" And I'm like, "Yes, yes, yes," because when you get home and you've just started holding a baby, what happens? This shoulder crunches up, right? Because what are you doing?
Yes,
We're looking at the baby, right?
constantly. Like it's just the constant pain, right here.
Totally. It's like more intense than a cell phone. And it's always people say it like they're the first person that's ever had it. I just have this. I can't even believe it. And I'm like, it's intense. I've seen shoulders like that, except with people carrying newborns. And it's because when you hold a newborn, you're not just holding like a sack of potatoes. You're cradling and using all these like small muscles, and you're really like, especially when baby's brand new, a lot of people are nervous. So you're just like clenched tight, right? You're also so in love with your baby that you're just like staring at him the whole time, which is
Constantly.
perfectly appropriate.
Yes.
So, not just the birthing person, but the partner has this too, because the partner is also holding the baby. So we forget that they also need work, and you need to support the supporters so that they can support, right?
Exactly. It's a full circle, a whole circle that keeps going round and round.
Totally. So I often go in and I work with a birthing person and a partner and maybe a nanny or a mom or an aunt or somebody that came in also, you know,
Mm-hmm.
and it's like a whole family affair, because this is a time where you need to really spend a little bit of time, energy, money, and effort to heal. With the
Yes.
first 6 weeks postpartum, I like for you to get 4 massages within the first 6 weeks. I know that
Heard
sounds
that four
four for
massages.
6 weeks. I'd love for you to get a massage once a week, but I'm going to 6 weeks, four, done. I think it's a really important time. I think that
Yeah.
at the time you can really get off kilter, and a little bit of prevention is so much. What is it? An ounce of prevention is a pound of cure or whatever. Like let's get on top of it. Like let's have a good time. Let's not get you into a place where your body needs, it gets so out of alignment that it's going to take more later to restructure. You know, I people all the time. I also do a lot of work with the cesarean scar, like after 6 weeks that they've been cleared. That's very important. I see people that are like, oh, I have a 7-year-old or a 12-year-old and I had a cesarean. I never got my scar taken care of and I'm having these issues. And it's like, if you start working with the scar tissue after it's healed around 6 weeks, that is going to create a more functional scar, and that's going to help you throughout. You know, it's going to take less effort at that point than it will down the line.
Exactly, because it's flexible still. It's still fresh. That's the word. It's fresh. So
Yeah.
while it's fresh, you can move the blood, you can move the tissue, you can move it all around so that it moves with your body.
Yeah.
Got it. And so you can also have your massage therapist do a focus on the cesarean. Once it's healed over and the doctor's okay, start massaging that area as well.
Yes. Yes. I want a doctor's okay for that.
Yes.
I also advocate seeing a pelvic floor PT at that time. They do.
Of course. Oh, yes.
Yeah. I don't do internal work. I do external work, but pelvic floor PTs can do internal work and check you and just go get checked. Just know, you know. So I like to do abdominal work. Helps. I love to do abdominal work with everyone, but especially postpartum, also preconception. We won't even touch on that because that's too much right now. But getting that scar, but also your digestion and getting like the lymphatic moving in the abdominal area, all that stuff is going to like really, really help reconnect to your core. I won't go into the diastasis recti either. That's more of like a fitness professional thing, but all of that stuff needs to be addressed.
Got it. We addressed it this morning when we talked with our chiropractic doctor about that.
Yes. Yeah. I also work with a chiropractor. We're in the same office, and she does technique for pregnancy. And then she also there's a group called Birth Fit, and she does these Birth Fit classes that help bring the diastasis recti, close it back up, and help you like reconnect to your core. It's very subtle work that you do postpartum, but it's very profound.
Got it. Okay. And then let's talk about the magic of infant massage.
Yes.
It really is magic. I mean, my mom did it on me and taught me a lot, and not through teaching like this is what you do next, but really through showing me, just doing it. And I'm like, okay, we're gonna do that too. So I mean, this is like this is like the ancient techniques. Now let's bringing it into the world of actual massage therapy, and what are the benefits to doing an infant massage. And let's start from the beginning. How early can you do it? And what oils do you recommend,
Okay.
if any, to do the infant massage? So we'll start there.
Okay. You can start as soon as you want. Holding the baby starts that, form of touch and massage. You will obviously not be putting the baby on a table face down in a face cradle.
No.
Massage, it's going to look a little different. You can just hold the baby and do some light massage techniques, or you can set them down and have it at the same time every day, which is a really good habit to get into. Mm-hmm. I'd like to do infant massage before they're going down for their nap, so that they more easily transition into a nap. We all know, like, sometimes tired. This is a good cue to help them relax and get them into a little bit of a sleep.
Yes.
You might do 5 or 10 minutes. It's not a long session. Like 30 minutes would be like a long session with a baby that may or may not be achieved, but about 5 to 10 minutes. Do not force the baby to be massaged. Like, don't get too attached to, I've got to do this leg, so I've got to do the other leg. Babies, when they're done, they're done, Really, really, really important for digestion. You want to wait about 20 to 40 minutes after they've eaten to help do the belly for digestion.
Okay, 20 to 30 minutes after baby is eaten,
Yeah,
you can
yeah.
do a massage on that.
If you're looking at a baby, oh, sorry, I didn't bring, hold on, let me get my baby. I have
Yeah,
one.
I love her baby example. She does all of the techniques on baby.
I have a baby in my office, but I also have one at home. Um, and I really love this baby because they came with a
Oh,
onesie. If you notice, this is the digestion. So I love these onesies for instructional use. Um, you Lots of people say different ways. The thing that I really have liked to tell people is it's like a rainbow. So if you're looking at the baby, it's like a rainbow.
yeah.
And a lot of people use this instruction of I love you. So it's I
Mm-hmm.
love you. That's what a lot, but
Perfect.
yeah. So my sweet baby. Um, so digestion is one of the most important things. Colic, digestion, any of that stuff is like really helpful if baby's spitting up or fussy. That's very helpful. But also just from the outside, sorry, I don't have a huge screen. I know we're on like a small screen here, so this is not normally how I would massage babies. But anything you just move towards the heart with the arms, same
Okay.
legs. You want to just go in there. You're not doing a lot of pressure. It's very light. You're really just bonding. I start at the legs, I move up, do the arms, do the belly. Face and head is last. Sometimes these are um, a little bit tender and touchy. So, like, you want to be very soft with your strokes around the face. And then make sure that you avoid anything where if they've had a shot, like in their foot or somewhere, just
Mm-hmm.
be careful that, you're going to want to skip any of those areas if they've had any shots or pokes or prodding or anything.
Yeah. Can you tell us what, if any, oils that you use on baby?
Yes. So I like to use what parents have at home because that's what you're going to be using them with. I really like the Honest Company. They have a baby oil that's really nice. It's lightly scented. You don't want a lot of scent in there. You don't really need any scent at all. I like something very neutral, like grapeseed oil.
Okay.
You can use coconut. You can use some other things, but I would just go as neutral as possible. And
Yeah.
then if you have a lotion that you really love, like go organic, go clean, don't use anything that is like an adult lotion, nothing
Exactly.
perfumery that you would use in your daily life, but just something nice and clean and easy. And you don't even have to use lotion, honestly. You don't have to do oil at all. But after bath, if you're going to apply lotion and oil, that's a great time to also work in those massage techniques.
Exactly. Now, I notice, personally, I've observed that many newborns will come out with their legs kind of inverted a little bit. I mean, they were crunched up for 9 months, and so yeah, their legs are not straight as you may want them to be. And so, one of the things that I noticed was that my mom would start massaging them straight, and my son is now 2.5, and I can literally see the benefits of it, of
Yeah,
the early massages at getting their legs to just straighten out. Is that correct?
absolutely, absolutely. And like taking them through a gentle range of motion too. You can
Yes.
protecting like a lot of babies have torticollis, which is it's also called taco neck. So a lot of times they're adjusted to one side. So there's some different exercises that I do when I do Zoom infant massage instruction. We talk about like, just bringing toys so that they're moving over here, like trying testing them and seeing where they are, motion is. If they're looking a little bit tight, do a little bit more over here so that we can loosen that up and like open them up. You just want to think about alignment. I like to go very simple. I don't want, you don't have to like go to full massage school to do any of this. Like, I just want you to think about simple things you can do. And exactly what you're talking about, just like straightening the legs, straightening the legs. A lot of this is fairly intuitive.
Mm-hmm.
Your baby.
And can you talk about pressure? How much pressure is appropriate? Like, am I going as deep as going into my my hand? Am I going light that I can barely touch it? Like what? Because some parents may just be scared to like do how far do I pull? How deep
So,
do I go?
well, and it sounds like, oh, you're massaging a baby, we're doing this. Like Western culture has this like idea of like harder, better,
No.
nuts. Yeah, so you're not using a lot of pressure. You can actually use super light feathery strokes and a little bit of tapping that is beneficial for their nervous system. So that helps start their nervous system firing. So you want to do a little bit of that. But it can be ticklish and they might like it a little bit. They may not like excessive amounts of that.
Right.
That's
And
a
that's throughout the body. You can do that on the infant's body.
Absolutely. And that's really good. There's a light stroke that people, massage school, you call it a nerve stroke. And it really does kind of like, that
Oh
heightens
yeah.
a
Just
lot more, giving you like,
so relaxing. Yeah.
yeah, it's so calming and relaxing, but also like firing that nervous system. So that's really, you're not doing a lot of pressure. You're not going directly on a joint or a bone. You want to go into like the nice meaty thigh area,
Mhm.
the calf area, the arms, like these
Right.
sections, like you're skipping the wrist and the elbow and the joints and everything, and you're just going into the meaty parts.
Okay.
Yeah.
And so, in terms of the benefits, yes, it gets their nervous system to start activating. What else are the internal benefits of doing infant massage? On top of the bonding, yes, and the bonding that occurs by doing infant massage.
Yeah. Bonding's so great. This is also why I like the partner to learn this, because this gives the partner a good opportunity to bond, whereas the primary birthing parent has a little bit more access to that more quickly and easily.
Right.
Sleep is improved, weight gain is improved, it improves touch, sight, all the senses, motion, how they move. Some of the like massage is massage strokes, but it's also kind of moving the legs back and forth, like bicycling the legs, and that can help to like relieve any gas in the digestion, which is
Yes.
really great. It helps them learn to digest. A lot of new parents get really frustrated and they're like, I just don't understand why they're not digesting, and it's like they just got to earth, like
Give their stomach some time, give the little being a little bit of time.
it's like a brand new system.
It's not quite on yet.
Yeah, like it might need a little assistance to like get there. And you can physically see when you're massaging a baby, like they start and they've just fed and they're like super bloated, and then you like massage them and it like comes down a little bit. And
Right.
that's fun to see that you actually have, like, it's nice to empower parents to know that they have a tool that can help if you're like fussy or colicky or spit back up. It's like you have something to do instead of just throwing your hands up and saying, I don't know what's wrong.
Yeah, because that doesn't help anyone. It's like, okay, I'm just going to take it. No, here are some actual beneficial techniques.
Yeah. I really like empowerment. I think it's really important to be capable and empowered in whatever you do in your life, but especially during this time. This
Yes.
raising a baby, especially a brand new baby, feels very overwhelming at times. So if you have something to reach for, it gives you a little bit more control over the situation, and it's more calming for you as a parent, and your energy being calm is going to calm the baby.
Yes.
That's
So
it.
with Sally mentioning this, I'm also going to highlight her amazing giveaway that she has so graciously offered for a new parent or new couple to be able to engage in, which is a virtual infant massage session. So Sally will sit with you one-on-one, you and your baby, and give you techniques that you can start employing on a regular basis, and one lucky individual or couple is going to receive this. So make sure you follow our separate giveaway post that tells you exactly how to enter into this giveaway to do this infant massage. Oh my God, that's so cute. That's exactly how our son looked when I was doing massage. Like, okay, babe, just put your hands over the back and just go. Just
Totally.
go.
Totally. Totally.
So fantastic. And so in terms of how long you can do a massage on your child, is there a limit? Is there okay, well you're old now, so we don't need to do this to you anymore?
No, you can always do a massage. It will be different. It will change. Within like up to the first year is kind of considered infant massage. After that, it's still massage. You can always massage your baby. You know, the thing that I have found is like some babies love and crave touch. Some babies are not that crazy about touch. They
Yeah.
look little, but they're not, you know, babies already know they are or they're not, you know, massage people. You know, sometimes you see those babies and you're like, you're going to have a big spa bill. I'm sorry to tell you. That baby loves massage. Like you're in for it. But which is great, you know, and often I have, you know, parents that I still see for house calls and they have young kids and the kids pop on the table, you know, while I'm setting up and they're like, okay, I'm ready for mine, you know, and then they go to bed and they just want like a little bit of work and then
That's
they,
awesome. That's amazing.
yeah.
And for them to be comfortable with having touch and getting that type of therapy.
I think it's very important to learn what appropriate therapeutic touch, healthy touch is,
Mm-hmm.
you know, and when you learn that, you understand like what's appropriate for yourself. You can advocate for yourself. Young kids can advocate, you know, I like this touch. I don't like that touch. It
Yes.
helps.
And they can verbalize it.
Yes.
Yes. And
Yes.
be comfortable with verbalizing it at the same time.
Yes.
So I want to also talk about the brand new system that we're going to be releasing in quarter 1, and how Sally is also supporting us and providing her expertise for our pregnancy and infant loss system that we're going to be calling our healing butterfly system. And so Sally is coming on to talk about the different touch techniques that the birth person and the partner can do to support their healing and their grief and their loss during this time. And that it is also a time period where massage has a great benefit, not only physically, but also in the emotional and mental recovery of infant and pregnancy loss. So give us your 2 cents on that.
Yeah. You know, this is something I'm also very passionate about. I also play Tibetan bowls and do like guided sound meditations. And I do this for retreats for infant loss and miscarriage. And it's really important to hold space for people that are going through this. Obviously, it's an awful thing. Um, and it's wonderful to be able to have tools to help people during their grief. And physical touch is also so beneficial during this time because you're supporting them, you know, by holding energetic space, but also physically helping and supporting them. And it's something that's near and dear to my heart. Um, I see it a lot. I think that it, you know, miscarriage is something that is much more common and we don't talk about it very much. It's something
Yeah.
that's kind of hidden under the covers. And I am very passionate about people going through this having access to resources. So I'm so happy that you've launched this system because it's such a beautiful thing and it just helps anyone who loves people that are going through this have something to give and to do for them because you know a lot of people just kind of, oh, I'm staying away because I don't know what to do. I don't know how to help in any way. Obviously I can't, you know, make this better, you know, so what do I do? And so it's really nice to have your system out there to give people.
It will be out there. It's not out there yet. It
Well,
will be out
when
there.
it's out there,
It's
yes.
going to be out there. We anticipate end of
Yeah.
quarter 1. We're going to have our butterfly system out in the world so you can get it for yourself as soon as you go through this experience, or somebody that loves you wants to be able to give you something and just don't know what to do. Well, here is that practical, useful, and thoughtful gift and offering that you can give to someone who's experienced this devastating loss in their life.
Yeah. And, you know, one thing that I'm a very big advocate of is for some reason, have always had a very high level of self-confidence, but I know that like females, in the West typically have been bombarded with images and the language we use is like, oh, my body is terrible and it's awful. And people walk into my office all the time and say like, my body's a mess and it's just screwed up. And I'm like, it's not, your body's perfect.
Exactly.
And especially during this time, we can feel like blame and shame that something is wrong with our body. And that's not true. So massage really helps you reconnect with your physical body and know that body is a system that's beautiful and just needs a little healing. And I'm very passionate about people feeling
at home in their bodies.
Feeling at home in their bodies. Yeah. Loving their bodies, really appreciating the fact that we are humans having this human experience in a physical body, and that yes, yes, you can always improve here or there. I like to think of amplifying the good.
Yes.
You know what I mean? Versus like fixing or it's a mess. I don't like that language. And I think especially, surrounding
All
that.
unnecessary.
Yeah.
Unnecessary language that does not need to be a part of any type of language or conversation or even considered norm. It's not necessary anymore, and we can all move away from it.
So 2020. So leave it past.
All gone. Leave it back there. So I'm going to ask one last plug. Of all the Healing Mama offerings or systems or bundles or products or brand packs and brands and everything, is there anything that you consider your favorite that Healing Mama Co offers?
Those hospital panties that everyone will feel.
Yes, the mesh underwear, the goodness that stretches and covers and holds everything.
Genius. I think those and the padsicles are two things that aren't spoken about unless you're talking to your girlfriends and you're like, the rumor used to be like, steal as many as you can from the hospital because you couldn't get them anywhere, which is insane. Like, that's insane. But it's insane that we don't have resources available to people who need them.
We're here now.
So the fact that you have these,
we are here now.
I love that your stuff is so special in so many ways because you literally have thought of everything. And you also have a little booklet to go with it. So there's, so
important.
It's so important. And I love that you've put together
encyclopedia to labor, delivery, and postpartum care right here in your hands.
Totally. I'm always working in my office and on my website to have like lists of resources. And it seems like there are no resources until you start digging, and they really are out there. So compiling everything and giving them to people who need them is just such an amazing thing.
Thank you. We appreciate it. We appreciate the plug. And if you haven't seen, our fundraiser has officially kicked off. And so head over to our fundraiser page and check out what we have going on. Other than that, Sally, tell us all the ways that people can contact you if they want to look at your virtual services, if they want to ask you questions. What are the ways that people can contact you?
So website is womeninselfhealing.com. Instagram is
the abbreviation is WISH. How ingenious that is. Women in Self-Healing. WISH.
Yeah. Wish.
So good. Okay, tell us again. So we got your website and then your other contacts.
So website, Women in Self-Healing is Instagram, Gmail, website, the whole thing, right? So feel free to email me, message me on Instagram. I'm pretty active on Instagram. I do have a Facebook. I don't really use that as much, but email, ask me anything. I'm happy to pop on a Zoom and chat with you about anything. I do have some virtual offerings. I have some in-person offerings as well. I know you and I are a little bit distance apart, but for anybody in Canada, virtual, which is great. That's the one fantastic thing that came out of last year is I really did, change things so that I can do online. And if you are pregnant and you want some partner tips, feel free to pop on a Zoom with me. If you want an infant massage tutorial, pop on a Zoom with me. Yeah, I'm here for you. I want you to be successful. I want to say success.
Success in new parenthood, 100%. And you can always come to healingmamaco.com or .ca, click on Meet Our Experts, and you will see Sally and be directed directly to her contacts, and all of her details are there too. So many ways to get a hold of Sally is there as well. So Sally, thank you so much for your time today. We completely appreciate it, and we're looking forward to giving away a virtual infant massage to a lucky mama or papa and baby to benefit from that. Thank you, thank you, thank you, Sally. Have an amazing rest of your Tuesday. Bring us some of your sun. Bring it up north here to Canada.
Totally, I'll send it over.
Thanks so much. Take care.
Lena.
Bye.
Bye.